Right now, Central Florida is seeing an increase in leprosy cases, also known as Hansen's disease.
Researchers say it might be an endemic in the state, but it's not as common or as easily spread as we might think. West Virginia's Brevard County reporter Megan Moriarty explains why health experts say you should not panic.
A disease dating back 4,000 years is making its way through Central Florida. But what we think we know about leprosy, also known as Hansen's disease, could make it seem scarier than it actually is.
It is completely curable with the modern medication therapies that we have.
According to the CDC, leprosy was once this feared disease thought of as highly contagious and deadly, but it's actually hard to spread. Dr. Nishad Amin, Chief Medical Officer at Health First Palm Bay Hospital, explained how one might get it.
It's spread primarily by respiratory droplets, such as sneezing, coughing, with prolonged exposure. So say if somebody is infected just by sitting with them, shaking their hands, sharing meals, does not confer transmission of the infection. It is prolonged household for many months to years.
But there's also one other way to contract the disease, through armadillos. Dr. Amin says to keep your distance from them, don't feed them, and don't try to relocate them. Call animal control instead. He says armadillo-contaminated soil can also be a hazard, so wear gloves while gardening. So far this year, there's been 17 cases of Hansen's disease statewide, with just one in most of our counties except for Volusia, according to the Florida Department of Health. Last year, there were 36 cases in Florida, 6 in Brevard County, 2 in Lake, 8 in Volusia, and 1 or no cases in our other counties. In 2024, there were 20 cases statewide, so based on the data, cases are rising.
We know Florida, as per CDC, that it may be an endemic, low-level endemic area, but that does not mean that there is an outbreak.
Covering Brevard County, Megan Moriarty, West 2 News.
Symptoms mainly impact the skin, nerves, and lining of the nose. You'll notice those large white or red patches on the skin. It's important to get it treated as soon as possible. If treated too late, it can cause complications and disabilities. But again, this is all very rare, according to experts.